Denmark has temporarily halted the use of the COVID-19 vaccine manufactured by AstraZeneca.
Authorities in Denmark, Norway, and Iceland suspended the use of AstraZeneca's COVID-19 vaccine.
Thailand has joined several European countries in suspending the AstraZeneca vaccine.
Is this concern about one specific batch of the AstraZeneca vaccine that was sent to 17 European Union nations? So as a result, the European Medicines Agency is investigating, in fact, if there is a link between that particular batch of the vaccines that was produced, sent over to these countries, and the individuals getting these blood clots. Austria, Italy, Estonia, Lithuania, Luxembourg, and Latvia all saying that they have stopped inoculations from that specific batch until the investigation is concluded. The 500,000 AstraZeneca vaccines are in fact those that have been developed in India. They're the Covishield vaccines that were made in the Serum Institute. So while they are biologically, in terms of formula, exactly the same as the AstraZeneca vaccine, they are produced obviously in completely different geographic locations, but also under very different technical conditions as well. That's significant because, as I said, in the background, you've got this concern about the AstraZeneca vaccine and potential ramifications it's having.
Needs to be checked because that's how vaccine research works. And we still look at these vaccines as stage for trial. So this needs to be, everything which was reported needs to be checked.
Oxford-AstraZeneca vaccine has been shown to be safe and effective in randomized clinical trials. But as the AIMS director said, when you do a vaccination in populations which are elderly, you're going to see occurrence of blood clots naturally.
The World Health Organization says there's no reason to stop the use of the Oxford-AstraZeneca coronavirus vaccine.
England and the United Kingdom, we have what's called a yellow card scheme, so that whenever you give a drug or a vaccine to somebody and they develop an adverse event in the time after that, you generally, if you don't know it's for certain that it's not related to the vaccine or the drug, you then fill out a yellow card, and these are collated. And I've looked at the most recent analyses of both the Pfizer and the Oxford-AstraZeneca vaccines, and both of them have reported presence of pulmonary thromboembolism, which is sort of blood clots on the lung, at about 12 to 15 reports so far. And that's actually a lot less than you'd expect from normal incidence of the disease in the populations being vaccinated. Yes, blood clots are happening after vaccination, but they're almost certainly not caused by the vaccinations. That neither Pfizer nor Oxford-AstraZeneca actually increase the risk of anybody getting thromboembolism.
There is not necessarily any scientifically proven correlation between taking that particular vaccine and these blood clots.
The WHO says there is no reason to stop using the AstraZeneca COVID-19 vaccine.
Cautionary and measured in our actions. And therefore, we need to consider the global evidence. And the global evidence is that the AstraZeneca Oxford vaccine has been given in millions of doses, and we have not found any evidence that people vaccinated compared to people not vaccinated have suffered an excess of blood clotting. Of course, we know that COVID-19 disease per se also leads to clotting disorders. So there is a lot of, is this responsibility of the vaccine or other things could be happening? The vaccines per se save lives, but it is still important that we don't take drastic, what we call hairs running decisions, because the evidence clearly shows that the vaccine works, that the vaccine given in their millions of doses is safe and effective. This is most probably a coincidence rather than a cause and effect. Unfortunately, in these days of rapid news traveling with so many outlets, we need to get the message right. And the message is as follows. We are making sure that the vaccine is safe. We are looking into an association with, is it vaccine-caused clots at this point in time, we have no evidence to suggest that the vaccine causes clots.
Medical staff are hypervigilant for anything unusual. There's nothing to suggest a causal link between clots and the vaccine, so there seems no reason to be worried about either vaccine being used in the UK rollout.